So today I'm going to be talking about the many aspects of reliable, representative and valid expert elicitation, and really just providing a bit of an overview that will help to lay the foundations of some of the talks that are going to come through. Next slide. To start with, I think it's worth tackling this question, which is one that I've certainly faced, and I feel that many people who work with expert elicitation have faced, which is in 2021 going into 2022, are we done with experts? Next slide. Across the globe, we now have access to big data, new technologies, and the ability to share and collaborate on data and analyze data. And it's amazing what we can do these days with that. Next slide. We've had studies by Philip Tetlock and people showing kind of dismal performance of experts with statements like experts are no better than dart-throwing chimps. Next slide. And we find studies that experts can be biased. They're not these superhumans. So this is an example of sea turtles and a study that was undertaken to rank threats to sea turtles. And if you look in the results, the authors state that our results revealed patterns of expert bias. For example, respondents who worked on nest predation consistently scored nest predation hazards higher than those who did not, whereas those who worked on fisheries bycatch scored fisheries bycatch higher. And we do see this in domains, so people that are working on a particular drug are likely to score that as a higher risk than others. Next slide. And across the globe, we have some really unfortunate stories of quite catastrophic expert mistakes from wars that we've entered into, major engineering failures, major infrastructure failures, and introduced species that we've still not been able to eradicate that have cost millions, if not billions of dollars. Next slide. And we're living in an era where we have both political and public questioning and outright rejection of experts as being elites, or just questions about who is the best expert to choose and how do I know who to trust. So these are all questions I've confronted throughout my PhD, and I do have a rebuttal. It's not, and so to next slide. The first thing is to realize that yes, expert elicitation is one of the lower forms of empirical data. If you have strong evidence obtained from at least one properly designed randomized controlled trial of appropriate size, use that instead. So this is the evidence hierarchy from medicine. But what we find is that even in an age of amazing technology and unprecedented means to be able to analyze and collect that information, we still find that there are many questions that we just don't have the data, or the data that we do have doesn't answer the questions that we need to answer for our assessments and decisions. And so this is where we start to use expert elicitation. Next slide. Then you need to understand why experts make mistakes. So in many of those circumstances where I said experts made mistakes, if you actually go back into those case studies, you find that there was always one expert that actually was waving their hands and saying this is a mistake. And so sometimes we listen to the wrong experts, or they don't get listened to at all. And so we saw examples of this early in the pandemic. Some events are rare and they're unpredictable, so black swan and chaos theory. And even if you have the best data in the world, you're not going to be able to predict everything. And even if you can predict it, you may not be able to manage it. And then all of us, to make decisions, every decision we make, we tend to use heuristics, which can bias our judgments. So things like sourcing information that confirms our own belief, or judging an event by how easily it is recalled. And the fourth is that when we do need to use experts, we tend to use really poor elicitation methods. So we rely on a single expert, thinking that we can predict somebody that has super judgment. We use poor selection criteria to find the expert. We use unstructured elicitation of groups of experts, which can be prone to groupthink. We use vaguely defined questions and then wonder why the uncertainty stretches from 0 to 100. We have really poor question framing. We fail to elicit uncertainty, and we fail to provide the same level of transparency as we would provide to other forms of data. Next slide. No, but we do need to know how to use them wisely. Next slide. There's not much we can do about the first things, but what we can do is we can control the elicitation methods that we use to help reduce the reliance on biases and heuristics and help to make sure that we're correctly eliciting uncertainty. Next slide. So there are many fields that rely on expert elicitation, and from these fields have culminated a whole heap of guidance on how to use experts and structured elicitation protocols in particular. Next slide. So there's no single definition of what makes something a structured elicitation protocol compared to an ad hoc elicitation protocol. But a definition I really like is this one provided by Anka Hanya, which is first that they ask questions that have a clear operational meaning. And that is something that in principle would be measurable if time and resources would permit experiments. So we're remembering that if we had the data, we would have just used that, but these are questions that we don't have the data for, and so we need to rely on experts. They follow transparent methodological rules, that is, they're traceable, repeatable, and available for review. They anticipate and mitigate psychological and motivational biases. So we're asking questions about facts. The process is thoroughly documented, so anyone can see why the judgments, how the judgments were derived, and they provide opportunities for empirical evaluation and validation. Next slide. So I'm going to focus the final part of my presentation on 3 structured protocols that I'm kind of familiar with, and I would say that these are extensively used around the globe. They're not the only protocols, but it's a nice comparison to sort of understand the different flavors of structured expert elicitation out there. And if you want to understand more about the differences between these 3 protocols, there's 2 citations here that you could look at: the Hanya, Hemming and Nain in risk analysis, or the O'Hagan in American statistician. Next slide. So there's some similarities that these protocols have. The first is that they assume that the decision context, model, or assessment has been defined. And that it sounds like from what's been happening with ISAM, you've already started to go through those qualitative steps to start to define what are the questions that we really want to quantify. And that's really important. That's one of the first steps that you need to undertake. You need to make sure that the experts are used to estimate data. So you're not asking them what to do necessarily in these structured elicitation protocols. What you're asking is, how do the different actions affect the objectives, or how, what is the risk of doing action A versus action B? Using more than one expert, all of them use more than one expert. And that's based on this finding that it's really hard to find a single well calibrated or performing expert. But if we elicit a diverse group of individuals and then aggregate their judgments, what we find is that often, so long as they're diverse, their estimates tend to bracket the truth, and then we get an estimate that is closer to the truth and usually a better judgment. So it can be a robust way to get good judgments. And then we ask experts to provide their private individual estimates so that we avoid this groupthink and we're getting a diversity of opinions. Next slide. So some differences: there are different definitions of good judgment. So you want to, if you're using these protocols, understand what is it that I'm trying, what does a good judgment look like in this context? So an example would be in the IDEA protocol and say the classical model, they both use a term called calibration, but the way that they measure calibration is slightly different, and this can lead to very subtle differences in which experts or which aggregations might be the top ranking aggregations. So the IDEA protocol tends to assess the calibration of intervals. So 90% calibration means 9 out of 10 intervals would capture the truth, whereas the classical model goes a little bit more in depth and looks at multinomial distributions, assuming that a 90% credible interval, an ideal one, would have 5% of the realizations falling below the 5th quantile, 45 between the 5th and the 50th, 45 between the 50th and the 95th, and 5% above the 95th. So these are things to be aware of. Next one. Okay, there's differences in the level of interaction between experts. So the classical model, they all have a private individual estimate, and then they collect rationales. The IDEA protocol involves a discussion and then a revised private estimate. Shelf also has a discussion, so this is Tony O'Hagan's method, but then they have a revised group estimate where the group comes to a consensus distribution. Next slide. And there are differences between aggregations. So classical model always uses performance weights, and that is, it uses calibration questions to choose the aggregation that it should use, whether that's an equal weighted aggregation or a differential weighted aggregation. IDEA protocol has typically used equal weights, but we have recently been able to incorporate weighted aggregations. So we have used the classical model, and Shelf uses this behavioral aggregation method. Next slide. And the question formats. So you need to be aware of the different question formats for things like, particularly if you're going to use calibration questions, they may require that the questions or the answers are in a particular format so that you can apply the right scoring rules. So I won't go into this slide in any more detail, but there's different question formats that each use. Next slide. Okay, so do they improve judgments? Yeah, they do. There's a lot of evidence that they can improve judgments. And I think Anka, Roger Willie, Abigail, and others will start to explore that in their presentations. Thank you. That's it.